My name is Chris Lolley. I'm with Prevent Child Abuse Florida, where I have the pleasure to serve as the executive director. So Child Abuse Prevention Month is the 1 month out of 12 when we focus more on prevention, or as I say, we pay attention to prevention. ACEs is an acronym that stands for Adverse Childhood Experiences. The thing people typically think of is abuse or neglect or domestic violence. But they can also be things like just a divorce or separation amongst parents, or living with someone who has a substance abuse challenge, if you will, or living with someone who has mental health challenges as well. And we know ACEs, or those adverse experiences, can have short and long-term effects on children and then later on into adulthood. They can lead to increased risk, for example, for substance abuse or substance use. Can also lead to things like diabetes or heart disease. In the initial ACEs study that was done way back in the mid-90s, or the 1900s as we say, there were about 25-26% of those adults that had at least one ACE. However, there are a lot more prevalent than people think. For example, about 12% of that population had 4 or more ACEs. And the thing that I can tell you is that after we've done this resilient screenings that we've been going all over the state to do now for about 4 years or so, I can tell you that most of the audiences that we've been in front of having those community conversations mimic those results. We see, though, up to a third of that given set of people have 4 or more ACEs. And some people, of course, can have 5, 6, 7, 8. So they're a lot more common than people realize. Chances are most of the people who are watching this have had an adverse childhood experience. So normalizing that for parents, I think, acknowledging that those things do happen, but not to stop there, but to offer them an insight maybe into what are the strengths that they possess, what are their personal strengths, what are their family strengths, and what exists in the community. When we talk about these adverse childhood experiences, it's important for us to let people know this is not a death sentence. This is not a life sentence, because there's so many ways that people can heal or get help in healing. What we really want people to become aware of is what they can do to help prevent abuse or neglect. And that list is a mile long. We know supporting parents, number one, helping them be able to get the help they need when they need it. Even just cutting your neighbor's grass or watching their kids for them to go grocery shopping. It can lessen the effects as you go through time. If you think about what a difference one stable, caring adult can make in the life of a child, then we know that every time that child has an opportunity to interact with that person, and this is scientifically based, by the way, according to the latest studies that have been done, is that allows that child to understand that the environment or the people around him or her, the community, can be trusted. And so it lowers the anxiety or the stress level, which produce all those bad hormones and create a toxic stress that can really undermine health, whether that's physical, mental, emotional. We act like, a lot of times that our bodies are divided into those categories, when really we know that we only have one body and that everything is connected. So some resilience building strategies have to do with self-care. Like when you get on an airplane and the flight attendant says, put your mask on before you help those around you, or your child put their oxygen mask on, because we know you're not going to do much good if you're not able to help. So take care of yourself first. Find those things that give you strength, that give you peace. And for some people, that's a lot different. Some people do yoga, some people go to church, some people have a faith community or social network that they rely on. What are those protective factors that exist in the community that they can tap into to get the resources that they need to be able to make progress, to be able to move themselves forward, to be able to heal. I think one of the best ways is just to do what we're doing now, to talk about it, to recognize that adverse childhood experiences are going to happen, and try to figure out those ways to make them less, to limit the duration of those adverse experiences, but also to connect with others in your local community to find out what resources are available, or maybe more importantly, to find out what resources are not available. And then to advocate for those resources to not just be there, but to be accessible, affordable, and available when they're needed. So there are a lot of resources. They can go to 211, they can go to the Care Portal, they can go to My Florida, My Family, they can go to Hope for Healing, they can go Pathway to Prosperity, or just go to any directory of a city or county and look for those things that they actually need. And of course, I hope that the social workers would be able to help them make those informal connections too, because we all also know how important our social networks are. And one more thing I'll add to that is that they can join us in sharing all of our social media posts and helping us advance the awareness driving type activities that we do by participating in these activities and events anywhere they are. They're all over the state. If people want to find out more about what events are in their area, they can go to preventchildabusefl.org and check out the events page. If people want to know more, they can give me a call or reach out to me on email as well. The pinwheel is the national symbol for Child Abuse Prevention Month. But the pinwheel also is a great symbol for what we want, which is happy, healthy childhood, simply put. The pinwheel also only takes a little bit of wind to make it move, to turn it into action. So that's all we ask people to do, is to do their fair share, to do their part. And it only takes a little bit of action on their behalf to make a huge difference in the life of a child.